It's time now for the live coronavirus update for San Antonio and Bexar County. Let's listen in.
Ehrenberg with Bexar County Judge Nelson Wolf. Tonight we're joined by Dr. Anita Kurian, who is the Assistant Director of Metro Health, and this is our COVID-19 update for the San Antonio community. Tonight we're reporting 1,117 new cases of COVID-19, bringing our total to 81,174 since the pandemic began. Our 7-day moving average now is 832. For context, the daily average was approximately 200 at the start of the month, so it has increased steadily as this transmission has increased in this community. Fortunately, there are no new deaths to report tonight. However, our daily COVID hospitalizations, ICU visits, and ventilator needs continue to trend up steadily. We have 587 COVID-19 patients in the hospital tonight, which is up 5 from yesterday and 39 from Saturday. We have 182 patients in the ICU and 99 patients on ventilators this evening. That's 182 on the ICU and 99 on ventilators. Turning to our community's blood supply, today we are close to a 3-day supply in terms of our total inventory, the minimum required to meet the needs of hospital patients. The South Texas Blood and Tissue Center is working to reach a 7-day supply, which is considered adequate. However, the inventory of type O blood, which is used in emergencies, is still critical at only a 1-day supply. This means that the South Texas Blood and Tissue Center can immediately only fill about half of the orders hospitals place for type O blood, which essentially puts trauma patients at risk. If you're able, will you please step up and donate blood for patients in our community? The South Texas Blood and Tissue Center has 6 donor rooms in this area. You can make an appointment to donate at southtexasblood.org or schedule to give blood at University Hospital 210-358-2812. Before I turn it over to the judge, it's Monday, so let's take a look at the progress and warning indicators. The number of cases per 100,000 is in the orange, which is severe. The positivity rate actually went down slightly from 10% to 9.2%, but it remains in the orange, severe category. We believe that the decrease in positivity rate is likely due to the large number of people who were not symptomatic but still got tested before the holiday weekend. More testing is good. Hospital stress is still hovering in the moderate phase, and overall the risk level in our community has gone from light green to yellow, which means we are going to a category called worsening, and we got to keep that in mind given the continued increase in cases. As a result, the Metro Health Department is issuing some guidance today. I'll turn it to Dr. Kurian after Judge Wolf gives his update. Judge Wolf?
Yeah, thanks, Mayor. Let me first of all thank everybody for taking the necessary precautions over the Thanksgiving weekend. From the information I've been able to gather and from talking with friends and everybody else, I really think that everybody was very careful. And we're crossing our fingers that will show up. We won't know that to probably within 10 days or so after the Thanksgiving weekend, how well we did. But I just have a good sense that everybody was taking the precautions and doing what they needed to do to get us through this very hard period of time. We're continuing to watch the hospital numbers closely. We're still carrying over 76 patients from El Paso. That's a significant. That's about about 15% of the patients that are in our hospital are coming from El Paso. So that's put a little additional strain on the hospital, clocking us in now at about 15% capacity in terms of of COVID patients. But we're not spiking. We need to remember, while we have a continuing problem, it's not like what we had in the summer. We had 1,267 people in the hospital. I believe it was on July the 13th. So we're watching those numbers closely. That 9.2% positivity rate was certainly a step in the right direction. Now, it's always a question: how many people are you testing that are asymptomatic as opposed to those that have symptoms? You test all symptoms, you're going to get a higher positive rate. Test all asymptomatic, you're going to get a lower one. For example, in our jail, they're mostly all asymptomatic when they come in, and it runs anywhere from 1 to 3% of COVID symptoms. So it depends on what the mix is. We probably did have a little bit more asymptomatic people that were getting tested, but let's cross our fingers and hope that next week holds up okay.
Great. Thank you, Judge. And before we go to questions, let me turn it over to Dr. Anita Kurian with some additional guidance for our community.
Thank you, Mayor. As the Mayor mentioned earlier, we did issue a health directive today, which strongly recommend avoiding dining or gathering indoors with anyone who's not in your household. The more people you are around indoors, the greater the risk of COVID-19. Respiratory droplets that spread COVID-19 occasionally travel beyond 9 feet. So while wearing a mask mitigates the risk, it is...
And a daily update will continue on our KENS 5 Facebook page and on KENS5.com. Tonight, the city is reporting 1,117 new cases tonight, placing the total cases now over 81,000. There are no new deaths to report, but they did say that 587 people are in area hospitals. Mayor Nirenberg reports we've moved into the yellow or worsening risk level. Stay with us. We'll have more news after the break.